A Singapore study suggests that peer support could encourage adults with anxiety or depression to seek help. The report from Duke-NUS also finds that almost 4 in 5 with symptoms have not sought professional help. Among the 350 adults surveyed, 77% with anxiety or depression had not sought care from professionals such as psychiatrists and psychologists. One consultant says privacy and confidentiality are major barriers stopping many from seeking help.
There is still a fair bit of stigma and fear of judgment with regards to mental illnesses because it's perceived as a kind of a weakness and, in the individual. And particularly in workplaces, people are a bit more cautious about letting their colleagues know or their employers know because they feel that they might, their jobs might be affected. And sometimes people also normalize the symptoms of a disorder.
Despite the hesitation to seek help, nearly 2/3 are open to support from peers who have faced similar challenges. This suggests that community-based approaches could help with unmet mental health needs. About half preferred one-on-one intervention over group-based ones, while 43% said they would be more comfortable receiving help virtually. Researchers say these findings could help shape programs that are responsive to people's needs. One peer supporter says outreach often happens naturally and not always through formal channels.
Most often it really happens that you just go your normal way at work and you might see someone you actually already know, maybe your desk neighbor, maybe just a colleague in your team who is in distress, and you just ask a random question of how are you? Is everything okay? You look a little bit aloof or anything like this, and then you get into conversation. Or just by coincidence, you go for lunch with someone and then the conversation comes up.
And to tell us more about their findings and what this could mean for mental health support in Singapore, we're joined by Professor Eric Finkelstein, who is Executive Director of the Lien Centre for Palliative Care at Duke-NUS. Professor, great to have you with us.
Yeah, thanks for having me.
Well, let's start with the big why. Beyond stigma and earlier mentioned privacy and confidentiality issues, why are people not seeking professional help?
Yeah, great question. So there's actually multiple reasons for that, but I'm an economist by training, and in fact, one of the things that we found out was a major barrier was cost. It's expensive, and people are concerned about whether the cost is worth the return. Are they going to get better?
Well, let's look also at the finding that people are turning to their peers first. So it's a good sign that they're reaching out. Do you see this as a sign of empowerment in that sense, or do you think it also reflects a lack of trust in mental health care in Singapore?
So it's a mixed bag. I mean, certainly peers can offer value in lots of different ways, but the reality is a peer can't replace a trained mental health professional. And so I think if you're using a peer as a substitute for professional help, that's probably going to lead to problems down the road. But if the peer can help you and encourage you to go get access and act as a complement, then I think that's really a great thing and can actually make formal care even more effective.
So looking at what a peer can't do, perhaps, is the concern that it can be helpful to reach out to someone and have the immediate support. But how do we ensure then that peer support doesn't also lead to misinformation? It also doesn't lead to emotional harm even?
Yeah, great question. So there certainly are peer support training programs where peers are educated about what they should say, what they shouldn't say, and certainly to encourage the person with the condition to seek formal mental health care. But I think peers can be invaluable, certainly during crises, to help stabilize individuals, to provide hope, to provide encouragement. But ultimately, a peer is just not trained enough to be the solution by themselves.
So if you look at another finding that's quite interesting, it says that younger, higher income groups are more open to seeking treatment. Do you see a potential gap here between older and younger groups of people who might exhibit the symptoms of mental health issues but are not reaching out?
I do, but the reality is that's not true just for mental health care. Older individuals tend not to seek care for all sorts of problems, even things like vision problems, chronic conditions. And so older individuals are really in a position where they need help. They need people to go out and do screenings to promote mental well-being, to promote physical well-being, because oftentimes they will suffer in silence, unfortunately.
62% say they're open to peer support. How do you turn that from that one-off touch point, you're talking to your friend about some problems you have, into a sustained engagement?
Yeah, so I think that's hopeful. That's a great sign. And in fact, what we see from our data is that about 3/4 of people with mental health conditions don't seek any treatment, any formal treatment. But the fact that 62% are open to peer support is great. The challenge is then to make sure that there are multiple touch points and pathways to provide those peers. So certainly NUS, for example, provides peer support training. And so I think that's great. So employers that provide that training is wonderful. Touch points in the community, so you have community organizations that can advertise and train for peer supports is great. And I also think we should be thinking about peer support in schools. So people with lived experiences, whether they be youth advocates or older adults, can be great advocates and really encourage individuals to get involved. And those who seek care and get better then hopefully can become peer supporters themselves. And so creating an environment where peer support is just part of the community norm.
Yeah, an ecosystem that keeps regenerating itself.
Yeah.
Also, if peer support could be an entry point, since more people are willing to seek help from their friends, how do you think the mental health system in Singapore can be redesigned in a way, capitalizing on this willingness to reach their friends?
Yeah, I think that's a great question. I mean, the reality is the way healthcare is headed in general is moving out of the facility and into the community. So I think peer support is certainly consistent with this broader trend, and certainly with AI tools and technology, we can empower peers to provide more and do better. But as I said, we do run the risk of people using those peers as substitutes. So at the end of the day, peer supports are wonderful. We should encourage that, but I think we need to make sure that the peers are there really to help the individual through crises, to promote use of the formal healthcare system, and not as that substitute.
And also to not over-rely on peers. Do you see any blind spots that potentially can be addressed in order to direct more people and encourage more people to seek professional help?
Yeah, I do. I mean, the reality is there's a hesitation in Asia to seek mental health care. There's still stigma associated with it. So certainly I think Health Promotion Board and government agencies have and can do more efforts to reduce stigma, to promote uptake of mental health services, and also to create those additional touch points so that there are entryways into the system through peer supporters and through formal mental health care that will ultimately increase access for everybody who can benefit.
Professor, thank you so much for sharing your thoughts with us today.
Yeah, my pleasure. Thanks so much.
And that was Professor Eric Finkelstein from the Lien Centre for Palliative Care at Duke-NUS.